Today I am going to take a lesson on linking program evaluation to program development. After I finish my module, you will know the meaning of community programs, understand their importance and the steps that are involved. Also, you will evaluate the effectiveness of community program evaluation and analyze the importance of evaluation for program development. Let me give you an introduction. What are community psychology programs? Around the time of World War II, psychologists used to work in clinical or laboratory settings. However, this trend took a turn when there was a need to provide the public with mental health professionals. So, these psychologists were trained to work in the communities by having a direct contact with them. Programs were developed to help the communities. These included therapeutic services like the cognitive behavioral therapy, or known as CBT, to alter the cognitions of the disabled and in turn their behavior. Let me talk about program development and evaluation. What do you understand by program development? Program development refers to laying down the action plan for aiding a physically or mentally disabled person by his or her community. The services are not provided in a clinic but are provided by the members of the community or by the psychologists by being a part of the community. The program so developed would lay down the objectives of the community program and the areas to be dealt with. Now, this involves coming up with the plan of actions, which includes the initiatives to be taken to help the disabled. It also includes the way of reaching the individuals who need help as well as the methods of helping them. Let me talk to you about community mental health services. It is a system of providing mental health services to communities all over the world by mental health professionals. The services are provided by being a part of the community. These are services like halfway houses, clinics and daycare centers. This way, the mental health services are more accessible to the community and reach the weaker and vulnerable sections. Moving on to the next topic, which is program evaluation. After the program is developed, the programs are evaluated to check if they even work. Thorough evaluation is required before applying the programs on a community. According to Bloom, the evaluation reports received about how the program has earlier worked and the possibilities of it working in the future are known as program descriptions. In these reports, the personnel involved in the program are judged and assessed. Around the world, there exist many programs and interventions developed to improve conditions in local communities. Communities come together to reduce the level of violence that exists, to work for safe, affordable housing for everyone, or to help more students do well in the school, to give just a few examples. But how do we know whether these programs are working? If they are not effective, and even if they are, how can we improve them to make them better for local communities? And finally, how can an organization make intelligent choices about which promising programs are likely to work best for their communities? Over the past years, there has been a growing trend towards the better use of evaluation to understand and improve practice. The systematic use of evaluation has solved many problems and helped countless community-based organizations do what they do better. Now, despite an increased understanding of the need for and the use of evaluation, however, a basic agreed upon framework for program evaluation has been lacking. In 1997, scientists at the United States Center for Disease Control and Prevention recognized the need to develop such a framework. As a result of this, the CDC assembled an evaluation working group comprised of experts in the field of public health and evaluation. Members were asked to develop a framework that summarizes and organizes the basic elements of program evaluation. Now, by evaluation, we mean the systematic investigation of the merit, worth, or significance of an object or effort. Evaluation practice has changed dramatically during the past 3 decades. New methods and approaches have been developed, and it is now used for increasing diverse projects and audiences. The term program is used to describe the object or effort that is being evaluated. It may apply to any action with the goal of improving outcomes for the whole communities, for more specific sectors, for example, like schools or workplaces, or for subgroups, example, the youth, or the people experiencing violence, or the HIV/AIDS patients. This definition is meant to be very broad. Let me give you a few examples of the different types of programs. Direct service interventions, example, a program that offers free breakfast to improve nutrition for grade school children. Community mobilization efforts, for example, organizing a boycott of California grapes to improve the economic well-being of farm workers. It could be research initiatives, example, an effort to find out whether inequities in health outcomes based on race can be reduced. Surveillance system, example, whether early detection of school readiness improves educational outcomes. Advocacy work, example, a campaign to influence the state legislature to pass legislation regarding tobacco control. Social marketing campaigns, example, a campaign in the third world encouraging mothers to breastfeed their babies to reduce infant mortality. Infrastructure building projects, example, a program to build the capacity of state agencies to support community development initiatives. Training programs, example, a job training program to reduce unemployment in urban neighborhoods. Administrative programs, example, an incentive program to improve efficiency of health services. Moving on to program evaluation. The type of evaluation discussed by me is an essential organizational practice for all types of community health and development work. It is a way to evaluate the scientific projects and activities that community groups may take part in, rather than to evaluate an entire organization or comprehensive community initiative. Stakeholders refer to those who care about the program or effort. These may include those presumed to benefit, example, the children and their parents or guardians, and those with particular influence, example, the elected or appointed officials, and also those who might support the effort, example, potential allies, or oppose it, potential opponents. Now, the key question in thinking about stakeholders are: who cares and what do they care about? Why evaluate community health and development programs? We do that because it complements the program management by 1. Helping to clarify program plans, 2. Improving communication among partners, and 3. Gathering the feedback needed to improve and be accountable for program effectiveness. It is important to remember too that evaluation is not a new activity for those of us working to improve our communities. In fact, we assess the merit of our work all the time when we ask questions, consult partners, make assessments based on feedback, and then use those judgments to improve our work. When the stakes are low, this type of informal evaluation might be enough. However, when the stakes are raised, when a good deal of time or money is involved, or when many people may be affected, then it may make sense for your organization to use evaluation procedures that are formal, visible, and justifiable. How do we evaluate a specific program? Now, before your organization starts with a program evaluation, your group should be very clear about the answers to the following questions. 1. What will be evaluated? 2. What criteria will be used to judge program performance? 3. What standards of performance on the criteria must be reached for the program to be considered successful? 4. What evidence will indicate performance on the criteria relative to the standards? And 5th, what conclusions about program performance are justified based on the available evidence? Now, how does one develop an evaluation plan? There are 4 main steps to developing an evaluation plan. 1. Clarifying program objectives and goals. 2. Developing evaluation questions. 3. Developing evaluation methods. And 4th, setting up a timeline for evaluation activities. Let me begin by talking about the clarifying of program objectives and goals. This is the first step to clarify the objectives and goals of your initiative. What are the main things that you want to accomplish and how have you set out to accomplish them? Clarifying these will help you to identify which major program components should be evaluated. Now, one way to do this is to make a table of program components and elements. Then is developing evaluation questions, which includes planning and implementation issues. How well was the program or initiative planned out and how well was that plan put into practice? The possible questions could be: who participates? Is there diversity among participants? Why do participants enter and leave your program? Are there a variety of services and alternative activities generated? Do those most in need of help actually receive the services? Are community members satisfied with the program meets local needs? Possible methods to answer these questions are monitoring system that tracks actions and accomplishments related to bringing about the mission of the initiative, member survey of satisfaction with goals, member survey of satisfaction with outcomes. The next is assessing attainment of objectives. How well has the program or initiative met its stated objectives? Now, the possible questions could be: how many people participate? How many hours are participants involved? And the possible methods to answer those questions are monitoring system, member survey of satisfaction and outcomes, and goal attainment scaling. Moving on to impact on participants. How much and what kind of difference has the program or initiative made for its targets of change? Here the possible questions could be: how has behavior changed as a result of participation in the program? Are participants satisfied with the experience? Were there any negative results from participation in the program? The possible methods to answer these questions are member survey of satisfaction with goals, member survey of satisfaction with outcomes, behavioral surveys, interviews with key participants. Impact on the community. How much and what kind of difference has the program or initiative made on the community as a whole? Now, the possible questions here could be: what resulted from the program? Were there any negative results from the program? Do the benefits of the program outweigh the costs? And the possible methods to answer these questions could be behavioral surveys, interviews with key informants, and community level indicators. Moving on to developing evaluation methods. Once you have come up with the questions you wanted to answer in your evaluation, the next step is to decide what methods will be best to address these questions. There has to be a monitoring and feedback system. Monitoring and feedback system has 3 main elements. 1. Process measures. These tell you about what you did to implement your initiative. Outcome measures. These tell you about the results, what the results were. And third, the observational system. That is whether whatever you do to keep track of the initiative while it is happening. Member surveys about the initiative. There are 3 kinds of member surveys you're most likely to need to use at this point. Member survey of goals, which is done before the initiative begins. How do your members think you are going to do it? Then is member survey process, done during the initiative. How are you doing so far? And then finally is the member survey outcomes, done after the initiative is finished. How did you do? Moving on to behavioral surveys. Behavioral surveys help you find out what sort of risk factors people are taking part in and the level to which they are doing so. For example, if your coalition is working on an initiative to reduce car accidents in your area, one risk behavior to do A survey will be on drunken driving. Interviews with key participants. The key participants, that is leaders in your community, people on your staff, etc., have insights that you can really make use of. Interviewing them to get their viewpoint on critical points in the history of your initiative can help you learn more about the quality of your initiative, identify factors that affected the success or failure of certain events, provide you with the history of your initiative, and give you insight which you can use in planning and renewable effort. Moving on to community level indicators of impact. These are tested and true markers that help you assess the ultimate outcome of your initiative. For substance abuse coalitions, for example, the US Centers of Substance Abuse Prevention and the regional drug initiatives in Oregon recommended several proven indicators. For example, the single nighttime car crashes, emergency transport related to alcohol, which can help coalitions figure out the extent of substance abuse in their communities. Studying community level indicators helps you provide solid evidence of the effectiveness of your initiative and determine how successful key components have been. Moving on to setting up a timeline for evaluation activities. When does evaluation need to begin? The answer is right now, or at least at the beginning of the initiative. Evaluation isn't something you should be waiting to think about until after everything else has been done. To get an accurate, clear picture of what your group has been doing and how well you have been doing it, it's important to start paying attention to evaluate right from the start. If you're already part of the way into your initiative, however, don't scrap the idea of evaluation altogether. Even if you start late, you can still gather information that could prove very useful to you in improving your initiative. When do feedback and reports need to be provided? Of course, you will provide feedback and reports at the end of the evaluation, but you should also provide periodic feedback and reports throughout the duration of the project or initiative. In particular, since you should provide feedback and reports at the meetings of your steering committee or overall coalition, find out ahead of time how often they would like to have updates. When should the evaluation end? Shortly after the end of the project, usually when the final report is due. Don't wait too long after the project has been completed to finish up the evaluation. It's best to do it while everything else is still fresh in your mind and you can still get access to any information that you might need. The different types of program evaluation are formative, which focuses on the development of the program, like attaining resources for the program to be applied, and they are summative, which focuses on the program results and involves concerns related to the effectiveness and quality of the program. What are the principles in program evaluation? 1. Assessment of program theory. Health programs have theories of action or logic models, which are statements linking the problems to be assessed, the ways to assessing them, and the potential outcomes. Then is the consideration of evaluation tools for each community. According to COMFA, there should be standard measures of evaluation, but at the same time, the differences between the various communities in terms of age groups, gender, culture, and other practices and norms should be considered. Qualitative and quantitative evaluation. According to Yin, answers to questions asking who, what, and when are quantitative. On the other hand, answers to questions asking how and why are qualitative. Both the aspects of the situation should be covered. The next point is social ecology and social system. These principles explicate the social and environmental aspects of human behavior. The problems which have occurred have cultivated in a social setting. Therefore, there should be a focus on ecology-based evaluation. Then comes the involvement of local stakeholders. The involvement of the community members bridges the gap between the evaluator and the community. Their participation should enhance the quality of evaluation by understanding the problems to be targeted and reducing the program costs. Finally, linking the program evaluation and program development. Evaluation is a part of development. Program evaluation should be an integral part of program development. This would ensure that the researcher is aware of all the aspects of the community and the targeted population. If the investigator takes reports of the individuals who need help, he should be aware of the original design of the program. There is uncertainty as to the effectiveness of the program before it is implemented. The program needs to be altered according to the needs of the community members. There should not be rigidity in terms of accepting a design. Therefore, program evaluation ensures that there are records for future research. Therefore, the investigator should evaluate the various aspects of the program designs, alter the necessary methods, and continue with the evaluation even after the implementation of the design. The background data about the target population should be attained, and the hypothesis should be formulated on the basis of the theory so attained. The measurement scales and instruments are then formed according to the needs of the population. Therefore, program evaluation involves personnel who are aware of other disciplines as well. Now, this evaluation helps in the development of the programs. Even during the course of the program, implementation and evaluation continues. Let me summarize my lecture. Community programs are developed to help the community members deal with the adversities of life by providing them with healthcare services and educational and other facilities. There are institutions which provide mental health services for problems like alcohol abuse and drug addiction by being part of the community. Programs are developed for this purpose. However, effective evaluation of the population, various aspects of it, and the history and of the efficiency and the measurement tools is required. The evaluation helps in forming a formal design of the program. Therefore, it can be concluded that evaluation leads to program formation and development as well as its continued effectiveness.